I'm Chynae. I'm going to be administering Emma Wrightson's Methylprednisolone today. So I've already grabbed the drug from the Pyxis, so I'm just going to perform my first med check. So Emma Wrightson, 30 years old, allergic to morphine, methylprednisolone, 75 milligrams, and I have 125. Be given IV. According to this, it can be, and every 6 hours. The time is now. The expiry date is good, and I've also checked the expiry date on my sterile water. That's also good. So my patient's receiving methylprednisolone for their rheumatoid arthritis to decrease their inflammation. They also have a history of hypertension, so I'm not going to be fluid overloading them today just because I don't want them to have too much fluid in there. So methylprednisolone is a steroid. To be administered by a student nurse. The usual dose is 1 gram, so I'm not exceeding that. I have a 125 milligram vial, the diluted sterile water, 2 milliliters, final volume of 2 milliliters, and a final concentration of 62.5 milligrams per milliliter. I'm giving it mini bag today. As I said, I'm not giving them too much fluid. So for doses less than 250 milligrams, I'm going to after reconstitution, I'm diluting in a 50 normal saline, and I'm going to be giving it over 30 minutes today because this is their first time using it. I don't want to give it too quickly. This medication is also compatible with normal saline, D5W, and dextrose saline combinations. And I have a dextrose saline combination infusing in my primary line right now, so I know that this is compatible with my primary infusion. So what I'm going to do now is I'm going to start my reconstitution. So I've already done my calculation here. And I know that I have to have 1.2 milliliters that I need to drop after the reconstitution. So I'm going to start by just swabbing my sterile water for 30 seconds and allow it to dry for 15. And then I'm going to take a new swab. I'm going to swab my drug for 30, allow to dry for 15. Those are in the garbage. I'm going to take my syringe here. I'm just going to pull back, keeping my plunger sterile. And I'm going to take my blunt fill needle, keeping everything sterile. No flaps, go back. Okay, so I'm going to pull back 2 milliliters of air. And I'm going to inject 2 milliliters of air into this vial, and I'm going to withdraw 2 milliliters of fluid. So I have 2 milliliters now. Okay, so this is still sterile, so what I'm going to do is I'm going to inject my dilutant into here, and I'm going to allow the air to come back out. I'm just going to remove this. I'm going to swoop and scoop. And I'm going to mix. This type of mixing, make sure that there's no air bubbles in there, and there's also no sediment at the bottom. Because I probably touched the top of my vial there, I'm going to swab for 30, allow to dry for 15. Because this blunt fill is still sterile, I can still use it, so I know that I need to inject 1.2 milliliters of air into my vial. And I'm just going to pull back.
15 minutes left.
Okay, so now I'm just going to get to the appropriate dose here. And I just do this over a sink. Okay, now I'm just going to cap. Okay, so as you can see, I have 1.2 milliliters in here. Okay, so that's the time for the second med check. So I'm going to do this with my drug, my prepared medication, and my MAR. So Emma Wrightson, and allergic to morphine, so methylprednisolone, 75 milligrams. So I took 1.2 milliliters from a 125 milligram vial. IV, according to my monograph, this can be given IV every 6 hours, and the time is now. So now what I'm going to do is I'm going to take my mini bag and I'm going to start my dilution. So I'm going to take a swab. I'm going to swab this tip here for 30 seconds. I'm going to allow it to dry for 15. I'm keeping this tip sterile, it can't touch anything. I'm going to take my blunt fill cap off. I'm going to inject straight in without perforating the edges. Check my med in. This can now be disposed of into the sharps container. I'm just going to gently mix, make sure all the medication is mixed in well. I'm going to add my label. And now I'm ready to gather my supplies to take to the bedside. So I have my tape here, which has my date and time for my tubing. And I have my tubing set and my MAR and my calculations. So I'm just gonna go into the bedside. Hi there, my name is Chynae Dyck. I'm gonna be your student nurse. I'm gonna perform hand hygiene and do an entrance safety check. I see that my primary line is infusing at the appropriate rate, has D5W normal saline going. It also has the date, time, and initials of the nurse who put this through. The tubing is labeled. I'm just making sure that everything is running through fine. Everything's open. There's no infiltration, pain, or swelling. Redness at the site. Could you just state your name and birth date for me? Okay, thank you. So I'm going to take my MAR here. I'm going to look at their wristband. And can you state your allergies? Thanks. So Emma writes in FIN number 123456789 and birth date. They're 30 years old. They're allergic to morphine, which matches my MAR. So my 2 patient identifiers have been completed. I'm just going to perform my third med check here. So my third med check includes my prepared medication and my MAR. So Emma writes in, Methylprednisolone, 75 milligrams, IV, and I'm giving this IV according to my monograph, every 6 hours, and I'm giving it every 6 hours, and the time is now. So I'm just going to perform my hand hygiene again. At this point, during the education session, my patient can refuse the medication if they so choose. So I'm just going to tell them, this is the methylprednisolone that you're receiving today for your rheumatoid arthritis. This is to help decrease your inflammation. Some side effects include peptic ulcers, so stomach irritation, as well as hyperglycemia. So if you're experiencing any side effects at all, please hit the call bell and let us know, okay? So they have not refused their medication, so I'm just going to start getting everything ready here. So I've got my tubing. My 2 ends have caps on and they're sterile. So I'm just going to lower my primary line first. Okay. So now what I'm going to do is I'm going to remove my blue cap and I'm going to remove my spike, being both sterile. I'm going to perforate. My tubing is clamped and closed. Okay, and now I'm just going to hang this above my primary line. And I'm going to be choosing the port above the pump so it can be regulated by the pump. Swabbing for 30, allowing to dry for 15. This is now sterile, as well as this cap, so I'm just going to, since those are both sterile, those can go together. I'm going to open my tubing. Okay, so now I'm just going to back prime. So I'm going to slowly lower my bag. So I'm just allowing my drip chamber to fill 1/3 to a half full. I'm going to keep this open for now. So now what I'm going to do is I'm going to set my rate and my volume. Secondary, and my rate is 102 milliliters per hour. My volume to be infused is 51.2 milliliters. I'm going to confirm my secondary, and now I can start. So I'm going to watch for my 3 drips here. I'm going to make sure everything's open and everything's infusing well. I'm going to check the site, make sure that there's no infiltration or pain at the site. I'm going to go over to my MAR, and I'm going to document that I'm my date, time, and initials of giving the medication. So then I'm also just going to stay with my patient for a couple minutes, make sure everything's running well, that they're feeling okay. I'm going to take my tape here, and I'm going to label my tubing with the date, time, and initials. And so nurses know when the tubing needs to be changed and when it was started. And I'm going to document in my flow sheet the ins and outs, how the patient tolerated procedure, and write an IPN if needed. And I'm also going to, before leaving, I'm going to put their call bell in place, make sure their bed is lowered, and I'm good.